Gauteng Health Department inspectors have uncovered the illegal sale of medicine at several places in the province. The department warned against the sale of this medication without proper licenses. The department says the sale is not only illegal, but places lives at risk. To discuss this some more, I'm joined now by Mokgadi Fafudi, Compliance Manager at the SA Health Products Regulatory Authority. A very good afternoon to you, Mokgadi. Thanks very much for your time. Quite concerning, obviously. One wonders just how widespread this problem is.
Good afternoon, Vuyo, and to your viewers. The scale of the problem is wide, Vuyo, and also if you look at the type of the products that are concerned, these are your lifestyle products that are found in those informal markets, as an example. And this does not only affect us locally, it's regionally in Africa, and it also spans globally as well. And these products are available in various provinces locally as well, as our inspectors as well do uncover such in the informal market. So it is a concern.
What do you mean when you say, for the sake of obvious, lifestyle products?
They say people want to be hot, people want to be high, and people want to be happy. So if you want to know which product are mostly concerning, these are some of the, especially with those that we have seen from the National Department of Health that they reported to us, together with those that our inspectors have covered and those that we have seen through our collaboration platforms. So these are the skin whitener, skin lightener, skin bleaches. So women would want to have lighter skin tones. So those are some of quite a number of them. And these are prescription substances, like they contain products that must be only given under the supervision of a medical practitioner or a health practitioner authorized to do so. And also, for example, the weight loss, women want to lose weight, men want to lose weight, and also in terms of steroids. So this is the hot part where what I'm talking about, that people want to look hot. And also the other products, it's those that when I speak about the high, these are substances that have got a euphoric effect after people take them, and those are some of those that we find in this illicit market being sold in retail outlets which are not supposed to be selling them. So, and then also those that we register for erectile dysfunction in social, those are used for sexual enhancement, and we see them a lot in such establishment. Those are some of the examples.
Well, I've also seen like headache tablets and rubbing stuff and all those things on the streets, actually, not even in the shops or the garages.
Yes, and amongst those, for example, the one that you read as headache tablets, you find that they contain a substance called codeine. So codeine has got that euphoric effect after some people do take it, and you would be aware that we have been also informing the public about the dangers of codeine because it can make people high. So those are the ones that you would find. And where do they come from? They come from the illicit channels. Some companies would report that medicines become their trucks become hijacked when they are supposed to be distributing medicines to a certain point. They get hijacked along the way. And then some just find themselves through the falsified market because of our borders. So you find that they come through, like if you look at some of the products are not those that are available in South Africa, but they are available in other markets. So they come through illegal channels. Because sometimes this is bigger, it's an organized crime. That's why I say it doesn't only affect South Africa, it affects the region in Africa and also globally. These are there's a common thread that there is possibly an organized crime, very sophisticated, with various distribution channels that is undetectable.
But then, whether it's products that make you high or sexual enhancement products, when people buy them, say, from the local supermarket or even spaza shop or the local filling station, I think for many people assume that these products are safe.
Yeah, however, you cannot get a medical product at an informal establishment. People must always take care of their health. The reason why SAPRA exists, we are a regulatory authority in South Africa to ensure that all medical products that are consumed by the public, they are of quality, safety, and they are effective. They do work. So we evaluate those products. Any medical product that comes into the country or that wants to market in the country, it has to go through SAPRA evaluation for its safety, for the quality, and for the efficacy. And therefore, and in terms of the law as well, Vuyo, we have got a supply chain that is regulated from manufacturing, from import, from distribution, from wholesale, and to the retail pharmacies and hospitals. Medicines must be sold in registered facility and must be sold by registered health professionals, such as your pharmacists or authorized doctors, or even nurses. But you need to use reputable establishment to do so. You cannot get your health products at any place because you do not know the condition under which they are being stored. Those people are not professionals. They were not trained to know what those products are, how they work, and how they should be handled, and what they do in human bodies. And these are very, very harmful in terms of the side effects. People may see the temporary effects, but the long-term effects can even lead to death or damage some organs. So we therefore urge the public not to be attracted to informal markets selling medicines.
Quick, maybe as a parting shot, whose job is it, and are they doing it, to protect effectively, unsuspecting and very desperate people?
This is a collaborative relationship that requires from the supply chain stakeholders. This is the whole pharmaceutical, because if we speak about medicines and medical devices, we're speaking about the medical industry, pharmaceutical industry. So all the role players, from manufacturers, from importers, throughout to the professionals who are issuing this, and together with the regulators, the tutory bodies that registered professionals, it is all ours, and also the members of the public and the civil society, to ensure that things that are available in the market, they are authorized to be there. They are in the illicit chain. Otherwise, they need to be reported to SAPRA or the Department of Health or Pharmacy Council so that we can investigate. Currently, because of this sketch, we are even working with the WHO. There is a pilot that WHO will be doing in South Africa with SAPRA, and we will be working with all the stakeholders that are very, very key. Media, traditional leaders, the public. We would be engaging everyone just to make sure that we fight this, from preventing them, detecting them, and also responding to them in the manner that even law enforcement will be able to take action with penalties that will be harsh for those that are endangering the public.